Stretch the oblique muscles to reduce tension in the obliques and the surrounding structures. The obliques are the medical name and the name used in the fitness community for the muscles on the side of the waist. Some people call them the side abs. I'm going to call them the obliques. That's what they are named. Throughout this whole video, I will use the term either obliques or oblique muscles. Move into a stretch slowly. Hold a mild, comfortable stretch and move out of the stretch slowly. Slow static stretches are most effective when they are performed after training, after activity, or after competition. The blood is flowing to the muscles. That is the ideal time to perform a slow static stretch. I am Dr. Donald Ozello of Championship Chiropractic in Las Vegas, Nevada. I am a Doctor of Chiropractic and a certified personal trainer. If you are interested in getting individualized training programs personalized to fit your needs, please feel free to contact me. I do my personal training online. The oblique muscles are located on the side of the waist. We have two layers of oblique muscles, the internal obliques and the external obliques. As you could tell by the name, the internal obliques are deep to the external obliques. Both the internal and the external obliques start in the back and wrap around to the front. The main difference is that the internal obliques wrap around to the front and run superior, which means they run upwards, and the external obliques wrap around to the front and they run inferior. When contracted concentrically, the oblique muscles can move the trunk in two planes. These planes are trunk abduction, which is bending side to side, and trunk rotation, which is turning side to side. When performing trunk abduction, you are bending to the side so that the lower part of the rib cage is moving towards the upper part of the side of the pelvis. Go ahead and put your hand or fingers on the lower part of the rib cage on the side, and on the other hand, put some fingers on the upper part of the pelvis on the side and bend to the side. That motion is being performed by the obliques. In this stretch, you are moving those two structures away from each other. To properly perform the standing oblique stretch, you can use an exercise ladder, a wall, or any structure that you can reach with both hands. Stand in good posture with your side facing an exercise ladder. I'm saying the term exercise ladder because that's what I'm using in the video. Your feet are close together and close to the ladder. Place your forearm on a ladder rung. With the opposite hand, reach overhead and grasp a higher ladder rung. Slowly stretch the pelvis away from the ladder by moving the pelvis away from the lower aspect of the rib cage. Hold a mild, comfortable stretch in the oblique muscles for 10 to 120 seconds. Now, I know this is a wide time range, but you have to find the time range that works best for you. I prefer to use 30 to 60 seconds. Move out of the stretch slowly and then repeat on the opposite side. Return to the original side and perform the stretch again. Once a mild, comfortable stretch is felt, rotate the pelvis posterior until a mild, comfortable stretch is felt. Hold this stretch for 10 to 120 seconds. Move out of the stretch slowly. Repeat on the opposite side. Return to the original side and perform another repetition. Once a mild, comfortable stretch is felt, rotate the pelvis anterior until a mild, comfortable stretch is felt. Hold this stretch for 10 to 120 seconds, then move out of the stretch slowly. Thank you for watching today's spine health video. Please see a medical professional to make sure you are healthy enough for exercise. You can work with a medical professional or a fitness professional to learn proper exercise technique. Viewing this video does not take the place of seeing a medical professional or working with a fitness professional. Never perform an exercise that elicits or intensifies symptoms. If an exercise elicits or intensifies symptoms, please stop immediately and find a viable substitute. When performing any exercise, always work through a symptom-free range of motion. When starting an exercise, always start at your current health, fitness, and strength level. Thanks again for watching today's video. Please like, comment, and subscribe. I am Dr. Donald Ozello of Championship Chiropractic in Las Vegas, Nevada. I am a Doctor of Chiropractic and a certified personal trainer. The foundation of my training programs is overall general conditioning with an emphasis on spine health and core conditioning. These two cornerstones of my training will help individuals reduce injury risk and recover from injuries. If you are interested in living a healthier, fitter, more functional life, gaining strength, increasing endurance, and improving your functional abilities, please contact me directly. I will provide all the necessary information.